So it's 9:30 now. We're a little bit pressed for time, so we're just going to get started. Welcome to our talk. Today, we're going to be speaking about the Hong Kong Community Resilience Index, which is a pilot study. And so in the next 50 minutes, a few of us from the Hong Kong Red Cross will be speaking about community resilience in Hong Kong, as well as the development of this tool. So let's get started. Yeah, as I mentioned before, please update your names. And if there are any questions for us during the talk, we do ask that you would ask them in the chat box instead of unmuting yourself. But just to let you know, we will have a section at the end where we have Q&A. So if possible, we can wait until the end to discuss these questions. For any IT-related matters, please just say something in the chat box and someone from our team will help you. And lastly, we do want to let everyone know that today's session will be recorded. And we just ask that people do not take pictures of anyone without their permission. So yeah, please just pay attention to that. And then for those who need translation for today's session, this is the option that you have to turn on AI-generated captions. So I'll leave the screen on for about 30 seconds in case someone needs to turn on captions. Today's session will be conducted in English. So I'll just give everyone a moment to do this. Okay, if everyone's all right, we'll get started. So today we have four main parts of our talk. Firstly, we will have one of our colleagues share a bit about the history of community resilience building efforts in Hong Kong. Secondly, we will be speaking about this index, what is it all about, the methodology, and our initial findings. And then thirdly, we will be spending some time reflecting on the lessons learned from our pilot study. And then finally, we'll have a short period of time where we will take some questions and have a short discussion. So today, I'm delighted to introduce our speakers. Here with us, we have Eva Young, who is the Senior Manager of the Community Resilience Service at Hong Kong Red Cross. Also here with us is Karina. She's the Manager of the Strategic Planning and Humanitarian Diplomacy Unit. And myself, I'm Christy. I'm an Assistant Manager for Research here. And so now I want to pass the time to Eva to speak to us a bit about the community resilience building efforts in Hong Kong and provide us some history. Pass the time to you, Eva.
Oh, thank you so much, Christy, and good morning, good afternoon, good evening to every one of you. Thank you for joining us this session. So I'm going to share with you about the background of Hong Kong in a generic scale, and what is going on in Hong Kong, and what are the potential risks that we are actually facing. And so next slide, please. Hong Kong is, we are facing different kinds of disasters. Please take one more, Christy. Yes, and we are under threat of different kinds of disaster risk, including typhoon, which is quite famous of that. And also with the extreme weather, we are facing a lot of rainstorm, heat waves, and air pollution, etc. And it makes us that we are one of the facing the highest risk in natural disasters in the Asian cities. And next slide, please. And for this disaster risk is not only affecting every one of us, but it is impacting some of us more unequally, I would say. And so that from the photos, you can see that there are different people living in different conditions, which is actually in Hong Kong. And I think this part of Hong Kong is not that famous to the world, but they are existing in our community, and they are severely facing different kind of disaster risks. Next slide, please. There are over 200,000 people who are living in squatter areas in Hong Kong. So even though we do not have many big rivers in Hong Kong, but we are susceptible to typhoons like I mentioned, and also a lot of rainstorms. And because we are a coastal city, And a lot of like small communities or squatter areas, they are along the coastal lines. And that will result in a lot of like sea level rise and sea level backflow. That means that we are, a lot of communities, they are facing like a seawater floods, we would say, we name that. And of course, we have a lot of like mountains, hills, and so we are also prone to landslides, especially to these kind of like accommodations. Next slide, please. There are also another over 200,000 people who are living in subdivided units. What is subdivided unit? You may click one more, Christy, please. Yes. Some people call that is like a shoebox flats or shoebox houses. It's like an original flat, which is divided into small units. And when people living in these kind of small units, they are facing a lot of issues, including like extreme heat because of the very poor in ventilation, and also a very high humid. In Hong Kong, we have many high-rise buildings, and these kind of subdivided units, they are mostly located in the city center. And that means that people are facing more severely under the impact of heat island effect. And so that like very hot weather and very high temperature and high humidity, and at the same time, bad air quality is impacting the people living in these kind of units. And also you can see from this photo showing that the hygiene is another issue. Some of these kind of units, they don't even have a window, or even they have a window, people are reluctant to open the window. So that is why, and why people are reluctant to open the window is sometimes it's because the window, the facing direction of the windows is not favorable to them. Sometimes when they open the window, it makes the hot air come into the house and makes it more hotter. Or sometimes because of the hygiene problem, they are afraid of the mouse, the mice, or the cockroach coming in, and that is the reality. And so a lot of them, they are reluctant to open the windows, and makes the unit even hotter or stuffy. And next slide, please. Yeah. So when the population in Hong Kong right now is about 7.5 million, and so that you can see that over 200,000 people are living in squatter area, over 200,000 people are living in subdivided units. That means that that is about 1 person per 50 person are living in these kind of squatter or subdivided units, which is quite an issue in Hong Kong. And with the background that I mentioned, we are prone to different kind of like sea floods and other kinds of like flooding, and also typhoon, landslides, and also heat waves. But how do people seeing the perception of facing high risk, and how do they getting prepared on this subject matter? You can see, you can see from this slide on the public resilience survey that the Hong Kong Red Cross has been conducted in the past 2 years. That was in 2021 and 2023. It was like subsequently we are conducting a survey to see how the people is like, are there any differences in in the level of people seeing how they are prone to disasters and how they are getting prepared. I don't know whether it is surprise or not, but we find that only 1/4 of population, they are seeing themselves are under high risk in the next 5 years. And also with the same percentage, people is like 25% of people, they are seeing that they are ready to respond to emergencies. But how about in real actions? How those are the figures I mentioned is just the perception or how they feel that. And but what is the actual actions they have been done? Is like less than 20% of people, they have been really participated in any kind of emergency drills in their daily lives. And very surprisingly to us is that the percentage drop in number of people they have actually joined any kind of emergency trainings. So it has been dropped from 12% to only 5%. That may be relating to the COVID period, but we don't truly understand all of the reasons from behind. Next slide, please. According to the situation that we are seeing in Hong Kong, so the Hong Kong Red Cross, we have developed our a resilience roadmap in Hong Kong. It is by referencing, of course, by referencing to the movement's community resilience roadmap. And at the same time, we are contextualizing with the situation in Hong Kong and also the capacity of the population. So we identified 3 pillars. One of it, the first pillar is about learning and empowerment, because we believe that people, they need to know the disaster risk, and they need to know what are the actions or what are the technical or any equipment they need to master when they need to face these kind of disasters. So information is the key. The second pillar is about bringing people together. We drive people to understand the situation they're facing, but at the same time, the capacity they have. And then we mobilize the people and hope that they own the activities, they own the projects, so they have to drive to continue doing what is good in their communities. The third pillar is about bringing other resources together. So it's like to identify other social capitals, to bring in more partnership, and also to build a leadership in different from different professional bodies, so that they can also contribute in building a resilient community in Hong Kong. Next slide, please. So I will give you a very prelim idea. What is the coverage of the work we are doing? So these are the project sites, I would say, that we are covering in the entire Hong Kong, in the rural communities, in different levels of involvement. And most of them are rural villages or squatter areas. One more click, please. And this is the urban inadequate housing. Yes, one more, please. Yeah, and so you can see that most of them are in the urban area and also in the city center part. And the yellow spots are all the subdivided units, or we call that inadequate housing in Hong Kong. And this is basically the coverage of what we are doing. Yeah, next slide, please. And yeah, these are the snapshots. You can see that we are going into the household and giving them some of the useful equipment or materials. Say, for example, to install the circulation fans or other better electric efficient appliances to improve the air quality, and also to improve the heat and humidity level for the indoor environment. And some of the photo, you can see that we are also installing different kinds of equipment. Say, for example, the solar lamps in the solar light in the squatter area, because it's very, very crowded and a lot of the paths without lighting. And so we look for a lot of different kinds of measures that is tailored for all these different locations or different communities, I would say. So there are a lot of like tailor-made solutions going into the communities. And at the same time, we also have a lot of education programs. So from kindergarten students to the adults, to the elderly, and also to the corporate as well. So we deliver emergency planning and business continuity planning trainings to the corporates so that they can also bring in the idea in their workplace. So we also organize different kinds of like forum and public activities for people from different aspects to join in easily so that they can get more information and they can be empowered. But what is next? So our experience is that we feel like that we have understood, or we have some information or data to understand the capacity of the general public in Hong Kong, and also some of the specific communities. And we try to develop a direction in a broader view. So we identify the 3 pillars that I mentioned. But at the same time, we find that it is not enough. And we want to, when we tailor different kinds of like pilot projects for different communities, we realize that we may also need a more comprehensive index or a more comprehensive direction that for us to compare whether our measurement is having a achievable goal, and whether the stakeholders that we have bring in are already enough, or we need to influence more people. And that is the start of the dialogue together with the research team, Christy and Karina. And that is the start that brought us together. And we discussed maybe we need something of like indicators and also a milestone for us to bring us go further. And so I think that is the background of how the communities in Hong Kong or general public in Hong Kong is facing now. And from the project aspect, from the service planning aspect, what we are also facing. So I will pass the floor to Christy to further explain on our study. Thank you, Christy.
Thank you, Eva, for your sharing about community resilience and its history in Hong Kong. I hope that this also provides everyone with a bit more context about why we need this Hong Kong Community Resilience Index. So in the next 10 to 15 minutes, I'll be sharing a bit about the development of this tool and our initial findings. So let's get started. What is the Hong Kong Community Resilience Index? So I think the easiest way to understand this is to think about it as a tool for measuring the level of community resilience in Hong Kong. And we set out to create this tool with 3 end goals. Firstly, that this tool would help us with long-term monitoring so that we would get a sense of the levels of community resilience in Hong Kong over time. Secondly, and relatedly, is that this tool would allow us to conduct a needs assessment to find out maybe which aspects of Hong Kong could be doing better to boost community resilience, and this could then inform service planning. Then our third goal with this index is also to conduct advocacy. So based on the results of our index, we hope to advocate for changes in policy or resource allocation to relevant stakeholders. And so I do want to mention that this is a pilot study. Our tool is not fully developed, and it is still a work in progress, but we do just want to share some insights now for everyone who's interested. Okay, so when we think about community resilience, it's kind of an abstract concept, and we need something to anchor us, or maybe some building blocks, right? Community resilience is made up of a lot of different things. And so in order for us to begin measuring community resilience, we needed a framework. And so we began by reviewing different literature from academic articles and also practitioner-based documents. So here I highlight 3 key documents that were helpful in the development of the Hong Kong Community Resilience Index. The first model is actually done in the US, and it's called the Disaster Resilience of Place model. It's an academic model of community resilience. And they posit that community resilience is made up of things like social resilience, economic resilience, infrastructural resilience, so on and so forth. And then some of you may be familiar with the IFRC's own framework of community resilience, which is more practitioner-based. And then we also took a look at the Australian Natural Disaster Resilience Index. So the point here is not to list all of the documents that we looked at, but to actually just show and demonstrate that between all these studies of community resilience, we actually find that they refer to a lot of the same concepts. So in the IFRC, you may note that economic resilience is actually kind of similar to economic opportunities. And so we see that there's a little bit of difference in naming between studies, but ultimately they refer to the same concepts. And so using this as our base, we arrive at the Hong Kong Community Resilience Index framework. And so this is basically what we posit as the 8 factors or building blocks of community resilience. And so we think this provides a comprehensive view of what a resilient community should have. So the 8 dimensions here that you see listed on the screen are risk management, health, basic needs, economic opportunities, infrastructure and services, natural resource management, social cohesion and inclusion, and connectedness. And so some of you may actually think that this looks quite familiar, and this is because we have taken the names and the items from the IFRC's own framework of community resilience. And we do this for 2 reasons. I think firstly, in terms of being a national society or part of a national society, it's good to be in line with the message or the movement of IFRC and their positioning on community resilience. But also secondly is that the IFRC's framework of community resilience was developed based on frontline experience. And so we really did want to reflect that in our own picture of what community resilience looks like. And so, yeah, these are the 8 dimensions that we have. And we think that by fulfilling or looking at these 8 dimensions of a community, we're able to get a sense of how resilient they are. Okay, so the next step is from these 8 dimensions, how do we turn this into something measurable? We need a score, right, to look at what this, how Hong Kong is doing in terms of community resilience. And so for our study, we actually decided to turn these 8 dimensions and make it a composite index. So our Hong Kong Community Resilience Index is actually a composite index. So some of you may be familiar with this. A famous composite index is like the UN Human Development Index. But for those who don't know, a composite index is basically a statistical tool that aggregates a lot of different individual indicators together to measure a complex multidimensional phenomenon. So what does that mean? For example, we have one dimension called economic opportunities, and employment rate is an indicator of economic opportunities. And we think about health, maybe how many doctors we have per 1,000 people is an indicator of the resilience of our health system. So we aggregate all these indicators together into one place to measure community resilience as a whole. So I hope that makes sense, that what a composite index is. And so by considering all these indicators together, we then arrive at a total score to assess community resilience in Hong Kong. So here I provide an example to make this a bit more concrete. In the health dimension, for example, this is just some of the indicators. I'm not listing everything that we used in the study. We looked at the doctors per capita, psychologists, and also hospital bed availability, right? If you're thinking about the health aspect of community resilience, it's about access to medical resources and also manpower. And so these were things that we chose to evaluate or measure in our study to get a sense of how resilient Hong Kong is as a community. So in our study, we actually had 98 indicators, and I will definitely not be listing them today in our presentation, but I do want to talk a little bit about how we selected these indicators for our study. So there were 3 main criteria. Firstly, that the indicators needed to be measurable and readily interpretable. So for example, if you look at doctors per capita, you can understand immediately what that means. And this is important because it allows us to track change over time. Having this number here is important. Secondly, all our indicators needed to be available in terms of data. So we wanted to not only know the number of doctors that we had in 2024, but we also want to know it for 2025, 2026, and so on and so forth, to fulfill the purpose of having this index as a long-term monitoring tool. So all our data sources also had to be accessible over time. And thirdly and finally is that each indicator should have a verified relationship to community resilience. And so we define this by either using indicators from previous academic studies of community resilience, or we also included indicators in our study based on consultation with our frontline colleagues, such as Eva and her team. So this is how we chose the indicators for our study. And then this is probably the most technical slide that we'll have in this presentation, but for those who are interested in the methodology with these 98 indicators, they're on different scales. So, right, I keep coming back to this example of doctors per 1,000 people. If I have 3 doctors per 1,000 people and I have a 90% employment rate, it's really hard for me to compare which is doing better than the other. And so in order for us to make this comparable, we had to rescale our indicators using a min-max transformation. So I put the formula here, but I won't be going into detail. But just so that you all know, we had to rescale our indicators to make them comparable and then aggregate them together. The second step that we did was that we calculated dimension scores. So the 8 dimensions I mentioned previously, they each have their own set of indicators. And then we took the average score of all these indicators, multiplied it by 100 to arrive at a dimension score between 0 and 100. And then finally, for the overall community resilience index score, we took the average of all these 8 dimensions to get an overview of how Hong Kong is doing for their community resilience. So this is how we calculated our index. And I will move on to results soon, but before that, I do want to highlight a few limitations to our method before we read the results. I think first and most importantly to highlight is that each index is obviously a construction, it's subjective, and I think sometimes it's easy to be misled. Right, if I see a score of 90, then I can immediately assume or believe that score. And I think there is validity to, there's merit to believing what somebody has spent time in constructing. But I think it's also important to remember that a composite index is really made up of the indicators that's inside it. And so these indicators are subject to debate. And so I think that's something to bear in mind, that the indicators are debatable, and also where indicators are placed. Some indicators may fit in the health dimension or the basic needs dimension, and that can affect the overall score of each dimension too. So I think that's something to bear in mind about our study. And then secondly, we assumed all indicators would have equal influence on community resilience in our pilot study. There are different reasons for doing this, and at this point, it was not justifiable for us to say that one indicator was more important than another. And a lot of existing studies also don't apply a weighting procedure, but it may be defensible to say that we need to add weights to certain indicators over others. That's just something to bear in mind before we reach our results. So if everyone is still with me, I do want to invite people to scan this QR code or log on to this Menti. We're going to do a little bit of result guessing. Yeah, what do people think is the highest scoring dimension that we'll find in the Community Resilience Index for Hong Kong? Maybe based on what Eva has shared with us, what do you expect us to have been doing well in? And what do we think people are doing not so well in Hong Kong? Or what do you think our city is not doing so well in, I should say? Can everyone see this Mentimeter? Interesting. So right now, basic needs is the highest scoring dimension. People assume it's the highest scoring dimension. Okay, I think that's almost all of us. 5 more seconds. All right. Okay. And then let's see what people say for the lowest scoring dimension. What do people think is the interesting lowest scoring dimension in Hong Kong? Okay, waiting on a few more responses, see if people will. Okay, right now, so the biggest vote goes to the connectedness dimension. Okay, thank you everyone for joining us in this little guessing game. I think it's also helpful to see what people's own experiences as well in their perception of community resilience in Hong Kong. So right here we have people think that basic needs is the highest scoring dimension and connectedness is the lowest scoring dimension. So let's keep this in our pocket and let's take a look at our results. Okay. Before I talk about our results, I do want to mention that this is confidential. We will be doing some publicity about the Hong Kong Community Resilience Study in the coming weeks. So we do ask that people refrain from taking pictures or sharing about the results online. But yeah, let's talk about the findings. Basic needs is actually third lowest. And so our highest scoring dimension from our index findings is actually the risk management dimension. And I think people were very close. They said that connectedness was the lowest scoring dimension. It's the second lowest dimension. And actually the lowest scoring dimension was natural resource management. So here we get an overview of our findings, our results of the Hong Kong Community Resilience Index. And we see that the average of these 8 dimensions is a score of 70. So from this, we can kind of interpret it as a moderate level of community resilience in Hong Kong. So I'm only going to be speaking about the top and bottom dimension in the next 2 minutes. But we find here that risk management is the highest scoring dimension in Hong Kong with a score of 88 out of 100. And this can be attributed in part to the fact that we have an early warning system and that there's some evidence of interdepartmental coordination within the government, and also that they've listed some partners, some NGO partners for emergency services. But it's not really clear what the quality of this partnership is or how often it's activated. We also found that the budget for disaster mitigation remained quite stable over the past 20 years. So yeah, this, I guess, suggests that there's consistent allocation of resources to disaster risk management. However, we also did note that employment in emergency services was low compared to the previous 20 years, which may pose a challenge to risk management in Hong Kong. And there was also missing data on disaster training statistics. We don't know how much of the population has been first aid trained or received disaster related training in the past year or so. And so I think this is quite similar to what Eva shared with us in the beginning about not knowing really the level of readiness that our community has. And the lowest scoring dimension we found was actually natural resource management. So that had a score of 47 out of 100. So while Hong Kong has a good natural buffer and a reasonable percentage of protected land, we did note that there was poor biodiversity. In terms of marine areas, there's a very low percentage allocated to be protected, and we also have an increasing number of endangered species in Hong Kong. In terms of resource consumption, we also found that while we're at a historical low, which means that people are using less energy per capita than before, we also found that the use of water was the highest that it had been in 20 years. And this may have implications for, of course, on the environment, but also for slow onset disasters like drought, whether we're really able to save our resources or use them sustainably. So this is just an overview really of our results of the Hong Kong Community Resilience Index. I didn't dive into each dimension here, but if you are curious about the findings, we will publish a research report next week on our Hong Kong Red Cross website. So feel free to take a look at that. But really, this is just the pilot study of this tool. And we hope that this gives you a little bit of a look into how this tool could be used, what results you expect to see from it, and how it's constructed. So in the next 5 to 10 minutes, Eva and I will be sharing a little bit about our lessons learned from this pilot study, and then we'll move on to a Q&A. So now I'll pass the time to Eva.
Thank you, Christy. Yeah, so we had a lot of discussion on how to nail down or how to define the dimensions that Christy just mentioned at the very beginning of the index. It is also because whether the global one that is using in the movement or other tools that already exist in other countries, whether they are, how applicable is that in Hong Kong. So we've gone through a lot of discussion on that, and so at the end we come up with these dimensions. And so at the same time, the dialogue was also involving how do we use it as a tool in different aspects. So I have two key points that from my aspect as a DRR practitioner, how I'm going to, or we are going to use this tool in to facilitate our DRR and resilient service development. One of the very key application is that we believe with the development of the index that will help us a lot in to facilitate the dialogue with different professional bodies, including that is the very strong stakeholder, which is the government, the different government departments. We hope to, by using this tool, to bring the more powerful people and more people who are interested in this aspect and bring them together. And so that we can have a more strong network in order to build or to strengthen the resilience in Hong Kong. And say, for example, when we are doing some of the really grassroots community work in the rural village in Hong Kong. So one of the work that we're doing is to build the evacuation mechanism in the village. And we will not say that there is none evacuation mechanism in the village, but the mechanism, the soft parts, it needs to be reviewed according to the actual needs or the real life in the community. So for example, one of the village, they have a evacuation, they have a shelter on top of the hill, but after years, I would say that over 70% or 80% of the village people, they are elderly, and they can hardly walk up to the hillside. So, but from the if we are seeing that from the official site or from the official document, they have already built or identified a shelter for this village. But and what we are doing is that currently we are facilitating different stakeholders alongside this community. Say, for example, there are different community centers or schools, international schools, or different public spaces. We liaise with those parties, and some of them, they are willing to open their space as an emergency shelter in times of like urgent needs. But we hope that this kind of like network or this kind of resources can be recognized under a very official way of mechanism, and so that this mechanism can be endorsed by in a formal way. And so that for the, say, for example, if we have this index, we hope that it can also facilitate how we measured, how we considered the resilience level of a community. And that, like, say, for example, how we see an infrastructure, how we see the mechanisms inside as an indicator is so important as one of the dimensions. And so that is one of the very key direction that we will use this tool, this index, as an advocacy tool. And other, as parallel, what is impacting us is that it can be used for as service planning for us. So when we are doing, like I mentioned, when we have piloted so many different kinds of like model in the community, we would like to see that is that what we are doing, whether it is enough or not. And we may not able to, and we are not going to do all of the work that we have measured under this index, but at least we understand what are the components that when we see a community, whether it is resilient or not in Hong Kong, so that we can advocate more of the needs of the in our society, in our city, and to different partners who are more relevant to these dimensions, and so that we have the common goal in achieving the resilience level. So that is from my aspect, that how I would say I would see that as a tool in advocacy and also service planning.
Thanks, Eva, for your sharing. And so this is the last slide of our presentation before we move to Q&A. I think something to bear in mind for this Hong Kong Community Resilience Index and its development is actually the trade-off, right? It's basically, I think, to sum up the slide, it's all a balancing act, really. So first, there's a trade-off between validity and the usability of the index. When we first started constructing it, it was, I think we started from a very academic standpoint of what community resilience looked like. But in talking to our colleagues, we realized that we also needed to consider the usability and relevance to frontline practitioners. And that resulted in the inclusion of some indicators that are very specific to Hong Kong, maybe more useful for, for our staff. And so there's that trade-off to bear in mind if someone were to implement a similar index elsewhere. And also, secondly, is that the index has a lot of different audiences. And so it's kind of related to the first point, but if we are presenting this index, for example, to government officials to do advocacy, versus presenting to maybe some academics or to other colleagues, this really affects the kind of indicators we include and how many indicators we include. So in our study, like you may remember that we've included 98 indicators. In academic studies, you wouldn't normally include as many indicators. You would want to create a concise tool. But I think because we have that end of advocacy, we also kept that in mind and listed a lot of indicators there so that it could be helpful, especially for when meeting with government or also for our staff to do service planning. So I think these are just some things and reflections to bear in mind in the development of the Hong Kong Community Resilience Index. And those are just our lessons learned. So now we want to move into a time of Q&A based on our sharing. We have about 8 minutes. So we just invite anyone with questions to ask in the chat. And then we will try our best to answer.
Hello, how are you guys? Are you getting me?
Yeah, we can hear you.
Thank you. Greetings from the Gambia Red Cross Society. I am Sirifo. It's a little bit late here, but then I think this is very important for the community resilient program that the Hong Kong Red Cross is doing. I think it's amazing. Keep it up. Good work. And definitely, I think that is the only way that we can promote resilience in our community. Going through the pillars that you have, learning and empowering pillar 1, community-led action and voluntary, and of course also social capitals. These are very important. So I think it's something that is commendable. And as a community resilient programming, the one that you have, though in the Gambia, we don't have such a model, but I think this is applicable to our national society and is a learning point. And we really like to associate ourselves with it and ensure that our communities continue to be resilient. Though we're doing some resilient programming, but the type that I have seen, I think is good that you have an indicator and you also have a tool that can be used to really develop our communities. So this has to continue, and national society has to work together to ensure that our communities become resilient and also protect ourselves from climate shock. So I wanted to know what were some of the challenges when you were developing this? Do you have any challenges at the community level? If so, how do you try to remedy such thing? But of course, I also want to thank the IFRC for organizing this very important night session. So the Gambia Red Cross Society is more than willing to learn from the Hong Kong Red Cross and partner national society to ensure our communities become resilient. Thank you very much.
Right. Thank you, Sheriful, for your very kind support and very encouraging message. And in fact, I would say that as I share, it is very important for us or a stage that we encounter that we need something else, or we need an additional information that could facilitate us to connect with different parties. And to me, I would say one of the difficulties or challenge is that when we have identified different when we see the result of the score, and so that means that we also identify different gaps that we need to work on. But at the same time, we also need to prioritize our ordinary or usual work in our national society, so that we need to really rethink about what we are doing, whether it is contributing to these service gap and also contributing to the index. But at the same time, are we really good at that, or are we going to do it by our own, or we use the index as a tool to influence other and for other more professional bodies to do that part? I think that is the most challenging part, or some big work that we need to do in our coming days.
Thanks, Eva, and thank you for the kind comment as well, Sherifo. So there are two questions in the chat box. Firstly, about sharing the slide deck. We're happy to do so. We can do this next Friday. So perhaps you can email one of us. One of us or the organizers. I can leave my email for you. We're happy to share. And then secondly, the second question is whether there are plans to calculate scores for different areas or communities of Hong Kong. This is a great question and something that we did consider actually in the development of this index at the district level. Yeah, I think right now we are aiming to do present an overview of the city in Hong Kong and its community resilience. But I do hope that maybe in a few years' time, the study can take that direction to reach the district level. I think a unique challenge to Hong Kong is that, of course, it's a very small place. And so the relevance of doing, not necessarily relevance, but it's really hard for us to get a sense of statistics or data even at that district level. We maybe lack that granularity. And also in terms of resources, because the city is so dense, it's all about like people access resources. So I think counting the number of resources in one place may not always be the most helpful, but I think more time needs to be spent on considering this question before we reach the district level. And I do think it would be a valuable endeavor. I hope that answers your question, Kirsten. So we have about 2 minutes left, but before everyone goes, we would like to ask people to fill out a feedback form for our workshop. So if you could scan the QR code and give us your feedback, that would be great. And thank you so much to everyone for joining us this morning or evening, wherever you are. We hope that this has been a fruitful sharing for people. And for any questions or follow-up, please feel free to contact us as well. Karina has left our emails in the chat box. So thank you everyone for your time.